Hi, this is Dr. A, and this is our fourth and last installment of Chapter 12 on Healthcare Ethics, and we are still in the 5th edition of Basics of the U.S. Healthcare System. So we're going to wrap this chapter up. So we're going to look at miscellaneous things. So other ethical issues. So the concept of medical tourism or medical value travel has evolved because the U.S. healthcare services can be very expensive. For example, U.S. Health and global health administrators collaborate with insurance companies to arrange for U.S. residents to obtain medical treatment in India. I also know of quite a few people that have gone to Mexico to get different elective surgeries, some of them regarding weight loss or implants and things like that, because even if they pay for them cash over there, they're still way cheaper than in the U.S. The United Group program offers living and deceased organ donor transplants from foreign countries. The U.S. organ transplants can cost $100,000, but are considerably less expensive overseas. So is this ethical? Again, why are ours so much more? Again, part of it is probably because our healthcare costs are so high, right? So let's talk a little bit about social justice in healthcare. And so the concept of social justice was developed in the 19th century during the Industrial Revolution, due to the major differences between the wealthy and the poor and the disparities between these groups for opportunities of wealth. So social justice has evolved into increasing the power of the marginalized groups who have been continually discriminated against in society. So a major goal of social justice is access to resources such as healthcare to these marginalized individuals. Healthcare disparities are often related to education, employment, and income status, and groups who have been historically marginalized are also vulnerable to these social injustices in their healthcare opportunities. Because of systemic injustices and racism, they also have not had as much education or employment or income status, which then puts them at a less advantage for the access to healthcare. Healthcare statistics indicate that 30% of medical costs of Blacks, Hispanics, and Asian Americans are tied to health inequities because of unequal access to healthcare. Research indicates that there's a systemic bias of discrimination in healthcare towards people of color, and this bias can be intentional or unintentional due to ignorance. And also things just like baked into the system, right? So racial bias, the term racial bias indicates that there are stereotypical attitudes and judgments towards people of color. Racial bias in healthcare is exemplified by lack of multilingual staff in healthcare facility, also lack of representation from some of the minorities or Black or brown people, especially like in mental health and stuff. So we have to look at, trying to increase the diversity in our providers for this. There is also poor access to healthcare services, and there is an unequal treatment of direct care, meaning like if a white female complained about something, a medical problem she's having, and a Black female complains about, they may be treated differently simply because of their race, right? Whereas maybe they'll believe the white woman but not the Black one. It's just kind of crazy. Healthcare statistics show that Black women giving birth have a disproportionate mortality rate than non-minority mothers because of the bias of their healthcare providers. And this is a very real problem, and it is more than double. It is really not acceptable. Implicit bias occurs when healthcare professionals make treatment decisions based on their own unconscious stereotypes about race. So this is a systemic problem that needs to be rectified through education and training. People are becoming aware of their implicit bias. You need to train clinicians to become culturally competent, and this should help them to, then you also need to help the clinicians and the staff to recognize their implicit bias. There is also algorithm bias. So this occurs when data that are already analyzed are based on previous inequities. For example, a study examining algorithmic biases examined one used by United Health to determine which patients would require more medical care. The results favored white patients over Black patients, prioritizing white patients over Black patients for care. But this was determined that the algorithm predicted future medical needs based on historical medical costs by the patients. It was a bias because Black patients had less access to care, and ultimately their costs were lower because they don't have access, so they don't spend as much, whereas white people had more access, so they spend more, so then they were flagged as needed more care and given priority. So that was kind of crazy. There has also been a lot of discussion about the inclusion of race in different equations to estimate the glomerular filtration rate. This has become controversial because this is one of the factors that we use to determine whether somebody would need to be placed on a transplant list or undergo dialysis and things. And part of this issue has caused, for example, some Blacks or African Americans to not get on the transplant list soon enough. Like they could have been placed on the transplant list sooner if a different equation was being used. And you can even also look at AI data sets and how things are done. It's really worth exploring like what data is used to feed the algorithm and if it is representative of the population. So what are the best practices to eliminate this algorithm bias? So yeah, review the data sets to ensure all representative populations are present. So for example, if you look at the data sets of genetic information that we are using, there is a disproportionate amount of white people in there because they tend to volunteer more for these types of research initiatives, whereas because of previous inequalities and even harm that was done to Black and brown populations through research, just go to Tuskegee stuff and look that up. They are less willing to engage in research and be subject to research and stuff, and so they're less represented. And even more so for some of the other populations, minority populations. So our genetic database should reflect the makeup of the different races, and our genetic databases should reflect the makeup of our population, but it doesn't. So we also need to review the predictions of the algorithm. Big data is a current trend for analysis in healthcare. You have to involve human decisions making to avoid any implicit data biases. Again, so it depends on these big data and this AI stuff. It's only as good as the data that it's fed and trained on, right? We need to examine zip codes using big data to ensure that marginalized populations are represented in the data set. So in conclusion, this ethics chapter discusses several ethical issues involving the healthcare industry and its stakeholders. Two components of ethics in healthcare are medical ethics, which focus on the treatment of the patient, and bioethics, which focus on technology and how it is utilized in healthcare. Social justice needs to be addressed in healthcare. It is unethical when people of color are treated poorly because of biases. And ethics can be interpreted differently by each individual. Everybody takes, even implicitly, again, you bring your own values and things into the decision process. The facts presented in this chapter can prompt discussions about the different ethical perceptions of individuals with regards to all of these healthcare issues presented. So I hope you found this helpful. And our next chapter is going to be on mental health.